Good morning, everybody, and thank you for being here. I want to start with a few remarks to set the stage for what we're going to discuss today, and then we'll take questions related to the public safety briefing that we're giving, followed by any other questions that you may have. First, let me acknowledge our team, the City Administrator Rashad Young, our public safety team, led by Deputy City Administrator Kevin Donahue, the Chief of Police, Kathy Lanier. I'm expecting there's the Chief, Chief Gregory Dean, the Fire Chief, as well as Melinda Bowling, who is the Director of the Department of Consumer and Regulatory Affairs. I also want to acknowledge our Health and Human Services team, led by Deputy Mayor Brenda Donald, our Director of Health, Dr. LaQuandra Nesbitt, and our Interim Behavioral Health Director, Dr. Barbara Bazron. And I, of course, want to acknowledge our partner in public safety and in the provision of human services, Sasha Bruce, and the Sasha Bruce House, I should say, and its Executive Director, Debbie Shore. So I want to thank our entire team for being here. So over the last several decades, we have seen major changes in how and why drug-related crimes are perpetrated in the District of Columbia. And so while most of MPD's drug enforcement units have been focused on the violent crimes associated with hundreds of open-air drug markets through the late 1990s, today's violent crimes are driven by very different criminal enterprises. The criminals of today are using evolving technology, social media, and the internet to facilitate commercial and street robberies and carrying out violent assaults against their rivals. Today, we are here to talk about a new approach to drug enforcement in Washington, D.C. The city is going to target the suppliers who feed dangerous narcotics into our communities and shift away from outdated tactics focused on low-level users. 2 new units will begin operations using these new strategies and tactics. The first unit will be a shift from 7 individual vice units to a citywide drug unit under the MPD Narcotics and Special Investigations Division. This centralized effort will allow MPD to disrupt the drug trade at multiple levels using a team that has advanced training and experience and that is supported by research, analysis, and the use of cutting-edge technology. The second big change will be the creation of the new Criminal Interdiction Unit. We'll call it CIU, a highly trained uniform unit which will place an emphasis on going after large suppliers, innovating their tactics to target new drugs, such as the synthetic drugs that we see that are attractive to young people, attractive to people all across the district, and that have very significant health effects and effects on public safety in the District of Columbia. We will use these new sophisticated techniques to counter the prevalence of technology in the marketing and distribution of drugs in our city. The CIU team will be at the forefront of how law enforcement identifies and abates crime patterns in D.C. It will remove dangerous offenders, drugs, and illegal weapons from our neighborhoods and drive down crime in our city. So we believe these significant strategic changes will be of great help for our police department, both in terms of combating the new environment of illegal drug manufacturing and sales, as well as increasing their visible presence in our communities and interacting with our residents. While the bad old days, as you will frequently hear me say, of the crack epidemic are behind us, you will remember these times. For me, it was not being able to go to the North Michigan Park Recreation Center because of open air drug sales. Far too many of our residents have been impacted and are still impacted by drug usage, whether because drug sales occurred near their homes or because their family members continue to suffer from drug addiction. This brings us to the next area that we aim to tackle: the troubling proliferation of synthetic drugs, commonly referred to as K2, Scooby Snacks, Bizarro, Spice, and others. And so I'm very pleased to be joined by members of the council who share my concern about the sale of these very dangerous drugs to all of our residents, young and old. So I want to thank the Ward 7 council member Yvette Alexander for being here, and the Ward 8 council member LaRuby May for being here. And I want to recognize the presence of Mr. McDuffie's chief of staff from Ward 5. Synthetic marijuana is a potent and dangerous hallucinogen that has been found at retail establishments across the District of Columbia, including liquor stores and gas stations. I also want to recognize a number of our retailers who have joined us, specifically the Korean American Grocers Association. If you're here, please raise your hand. And a number of our liquor store owners I know I see here, please raise your hand. And I want to acknowledge David Doe from our Office on Asian and Pacific Islander Affairs, because we know that we have so many responsible business owners and retailers in our city that have been providing quality goods and services in our neighborhoods for decades, during the bad old days and now. And they don't want to be associated with the retailers who would not do the right things and who are not doing the right things. And I'm pleased that they're stepping up in a leadership role to make sure that we have the laws in place that will keep district residents safe. In recent weeks, we have seen a dangerous spike in overdoses as a result of synthetic drugs. The spike has led to dozens of individuals being transported to area hospitals in the last month, and it is likely that additional overdoses have gone unreported or untreated. Synthetic drugs, don't be fooled by the names that they're marketed by, and don't be fooled by people calling it an equivalent to marijuana. Synthetic drugs are illegal, highly dangerous, and they are a clear and present danger to the public. We will do everything we can to crack down on the sale and use of synthetic drugs in our communities. We need to give law enforcement and our regulatory agencies the ability to crack down on these drugs. This week, we will submit emergency legislation to the Council of the District of Columbia to significantly increase the penalties for selling synthetic drugs in our city. My proposed emergency bill will be called the Sale of Synthetic Drugs Emergency Amendment Act of 2015. It will give the Chief of Police the authority to close down a business found selling synthetic drugs for up to 96 hours. This is a very similar to an existing law which gives the Chief of Police the ability to close down a liquor license establishment for up to 96 hours if violence occurred in that bar or club. My bill would also fine a business $10,000 for its first violation for selling synthetic drugs. It would require the business to submit a remediation plan that clearly lays out how the business will prevent any reoccurrence of selling synthetic drugs. And that's not it. We have to send the very clear message that we are serious. The bill would institute a two-strike rule. If a business is found to be selling a synthetic drug for a second time, the Chief of Police can shut it down for up to 30 days. It can be fined $20,000, and DCRA will move to permanently revoke its business license. So I hope that the residents of the District of Columbia can count on the council supporting this emergency. because it is an emergency. And I know if these women have anything to do with it, it will be passed on June 30th. So we need to move as quickly as possible in this legislation because our residents demand immediate action to remove this dangerous product from our streets. The final thing I want to announce is that I have charged my team with enhancing surveillance of use and reports of use of this drug. The Department of Health is moving expeditiously to establish a system for hospitals to report its increased levels of activity in emergency rooms related to synthetic drugs. Dr. Nesbitt met with emergency room doctors last week, and they are working with the department to develop a protocol to test individuals who present with symptoms of synthetic drug use. This will allow us to know exactly what materials that manufacturers are including in these lab manufactured drugs. I also, while we've talked about enforcement, both from the police side and our regulatory side, we know that there's no better effort that we can do other than preventing young people from getting involved with drugs in the first place. And that's why I'm so happy to be joined by Debbie Shore, who's been doing this work in our communities, working with young people to prevent them from using drugs in the first place. So I'm now going to turn to the council members for a quick statement, each starting with Council Member Alexander, who also chairs the Council's Committee on Health and Human Services. We'll hear from Council Member May, and then I'm going to ask the Chief of Police to come to the podium.
Good morning, and thank you, Mayor Bowser, for this aggressive and much needed action. You know, in Ward 7, I can attest to blatant sales of these synthetic drugs. And it's almost to the point where people think that there's no accountability or that this is legal activity in our ward. And I'm glad that our team from Health and Human Services is here because it's an education piece, too, that our young people need to know that these are not safe. These are not safe to use, and they can have mind-altering consequences, even death. So we need to educate our young people. I see some of our prevention centers out there, and thank you for what you do to educate our young people in our community. I just want to give fair warning, Mayor Bowser, because I know who some of these culprits are out there. So I'm giving fair warning to my businesses in Ward 7. I'm coming out to get you, and I'm going to send the chief out because I know where you are. I can attest to the fact, and my staffer is out there, my committee director, that we went to a store. Actually, I went to a store, believe it or not, and I was sold some Scooby snacks. And I couldn't purchase it with my credit card. I couldn't purchase. He told me it was cash only. So I was like, wow, this guy, I'm glad I look cool enough, I guess. That's a good thing. But what wasn't a good thing was that, you know, he just felt free to sell this to me. And this wasn't in Ward 7, believe it or not. So it is across the city. So it's not just east of the river. It is largely east of the river, but it's all over the city. And I want people to know that this will not be accepted. Thank you. We've seen the consequences, and we've seen the consequences with other drugs, too, with the PCP insurgents. And it's really crazy that people are doing this, but they're doing it. But we need to take strong action to let people know that we care enough about you, that this is unacceptable in the District of Columbia. So thank you, Mayor Bowser.
Thank you. Councilmember May.
Thank you and good morning. I'm not as tall as everybody else. So, let me first thank the mayor and her team for the leadership about synthetic marijuana and drugs, but in general about this new approach to public safety for our community. As we know, as many of you know, in Ward 8, public safety is an issue. And so I look forward to working with the chief and working with new measures of making sure that the residents of Ward 8 have what every resident in the district wants and deserves, and that is a safe community to live in. And I echo my colleague on the council that we are going to be aggressive in supporting the director of DCRA in PD and making sure that those establishments that are serving our young people and that are serving our vulnerable residents these synthetic drugs, that we're going to come, we're going to shut you down, we're going to make sure that you no longer exist unless, if you don't want to be a good neighbor, if you don't want to be a good business in Ward 8, then you should start looking in the county or somewhere else and leave the district, because we're committed, I'm committed, this mayor is committed, her staff and her team are committed to making sure that the District of Columbia is a healthy and a safe place to live. And so I look forward to supporting this bill when it's submitted to the council, and I encourage all of my colleagues to support this bill as we look forward to making greater accountability to those who are doing a disservice to our residents. Thank you, Mayor Bowser.
Thank you. So I have gotten to work with Chief Lanier for a long time, from the days when she was the commander of the 4th District. And then I noticed when I walked in, she proudly wears her pin that says serving since 1990. So she has seen the bad old days and now is working to make sure that every neighborhood can experience the good days that are now in the District of Columbia. Part of my message when I was nominated to be mayor last April, I had a conversation with the chief of police shortly thereafter. And she expressed to me then a vision for how she would attack the changing trends in crime in our city. Hers was not a vision focused on how things used to be and the tactics and strategies that used to work. It was, how is our city growing and changing? People are living in places they didn't live before. People are working in places that they didn't live before. Our people are communicating in ways and using tools that we never had before. So the police department had to change too. So the strategy that the chief is about to talk about reflects her vision for how we have to change police tactics to keep the Washington of now and the Washington of the future safe. Kathy Lanier.
There's nothing greater than, I'd say, for the agency directors. When Mayor Bowser took office, the first thing she said was, I'm looking for innovative and effective solutions. And not everybody in politics likes innovation, right? Because sometimes it's risky. But Mayor Bowser is very clear. She wants us to be effective. And so she's not opposed to making significant shifts in strategy that may not always be popular, but will work and make us more effective. And that's the culmination of all of the things that she talked about today, is everybody in the administration now is working towards those effective, innovative strategies. So if you think about the combination of our new drug enforcement strategy, our criminal interdiction unit that will actually hit the streets today, in combination with the legislation dealing with the synthetic drugs that have fast become one of our biggest public safety threats. People talk about a lot the impact of these synthetic drugs on the user, but the impact that we have seen over the past almost 4 years now of the impact of those drugs on people other than the user. We have had homicides that were carried out by persons high on those synthetic drugs and didn't recall what happened or didn't know why they were involved in that violent act at the end of the day. So these drugs are more than just dangerous to the user. They're dangerous to everybody in our community. So now for all of these things to roll out all at the same time, we will have a significant impact on those things that are creating safety issues in our neighborhoods. And for the business owners that are here, I want to commend you for being here. And I've walked through, not too far from here, down through the neighborhoods and into some of these businesses. If you're a good business and a good member of the community, we're going to support you. But if you're bringing this stuff in and selling it now, the penalty is just too great. It's not the cost of doing business anymore. You can't just sell it for cash and get a slap on the wrist, because a 96-hour shutdown is significant. So the criminal interdiction unit that we talked about will be rolling out this afternoon. There's a couple of members of the criminal interdiction unit here with me. You can see them over here. While they are not primarily a drug enforcement unit, they are working out of the Major Narcotics and Special Investigations Division. They will work in conjunction with our major case drug squad, our street level drug enforcement squad, our gun unit, and now the criminal interdiction unit. So it is a holistic approach to going after the two things that give us the biggest grief, right? That is the criminal enterprise that has repeat violent offenders that are carrying out multiple street robberies or commercial robberies through the criminal enterprise, or those that are involved with drugs and violence associated with it. So those teams will now work together for a centralized approach of going after those things that give us the biggest risk to our public across the city. So the big shift from 7 different vice units in each of the 7 districts now is to a more holistic approach that will deal with drug complaints, drug market, or I should say drug networks, which is more appropriate these days, and then those that are carrying out repeat violent crimes in our communities that result in people being injured and losing their life. So overall, rolling this out with the DCRA legislation, this is a win-win for everybody, and I'm looking forward to working with my partners at DCRA. Thank you.
I want to acknowledge that we've been joined by another member of the council who is very focused on public safety issues, making sure that we're giving the police and our regulatory agency the tools that they need. And he chairs the council's Committee on Public Safety and Justice, and he represents the residents of Ward 5. Kenyon McDuffie.
Thank you, Mayor Bowser. I'm going to keep my remarks very brief. Obviously, the focus is on public safety, and I appreciate what the mayor and Chief Lanier are doing with the steps here today. Obviously, synthetic drugs have been a problem in our community for quite some time. We've taken some steps in the past to try to get us closer to solving this problem, and I think what we're doing here today brings us one step closer to the problem. I want to recognize ANC Chair 5C, Jacqueline Manning, who I've worked with closely, who represents the area around where the clubs are, where we're having some of our most persistent problems. The chief has been working on this for quite some time. I think the combination of having MPD and DCRA focus on this problem is going to be great. I can tell you, as chair of the Committee on the Judiciary, I look forward to continuing to work with them. One of the things we're doing is looking at some of the other best practices that are happening around the country with respect to how you solve this problem of synthetic marijuana. We know that there have been issues with trying to keep up with the way that the compound changes, but there's some other things that we're looking at as well. If you are selling synthetic marijuana to kids in your store, there's a question as to whether or not you should be able to sell lottery tickets, whether or not you should be selling other things that can actually benefit you in terms of how much money you make in your store. This time, you're going to know it's going to hit you in your pocket. It will no longer be simply the cost of doing business when you sell these type of drugs in our community. So I want to thank the mayor for her working hard on this. I look forward to working with her and Chief Lanier and all the other stakeholders who are here today, and recognize my colleague Yvette Alexander as well, who's had some of these concerns in Ward 7. So thank you, Madam Mayor. Thank you, Chief Lanier, and thank you everybody here who's standing. And my Ward 8 colleague, LaRuby May, who I didn't see standing right behind me. But we are focused on this in a way that we haven't been in the past, and it's important for you all to know that. We're going to fix this. We're going to solve the problem. And if this step brings us one step closer, then it's something we should be doing, and we should be exploring everything. All options are on the table when it comes to this really important problem. So thank you again, Madam Mayor.
Thank you. And finally, we want to hear from our host and our partner in educating our young people about the dangers of using any drugs, and especially what synthetic drugs can do to them. Debbie.
Thank you so much. Thank you, and welcome to everyone here. And I just want to say that I, too, thank enormously this administration for taking up this issue and really leading the charge towards creating a much safer environment. Here at Sasha Bruce, we have been working for 40 years to provide services to young people who are away from their families, where families are having a lot of difficulty. We do workforce training, we do after-school programming. But in all of the young people and families we see, substance abuse is a major factor in why the difficulties are what they are or getting worse. And so we have been working for years to bring greater awareness and attention, and it has been a wonderful partnership for us to be part of the prevention centers. We are the Ward 5 and 6 prevention centers. There are other prevention centers that are here because the community activities are going out in the community, and we've been providing community engagement and community awareness around synthetic drugs for the last 4 years, 5 years. So to hear that this is going to go to the next step is really a wonderful support and a wonderful thing, I think, for making our city safer and for us to get our arms around the young people who really need us to provide that kind of support. So I acknowledge and thank this administration and think this is a wonderful step forward. Thank you.
Okay, so I'd like the city administrator and the deputy mayors to come closer and the directors to stay close because we will now entertain your questions about the public safety initiatives, and the chiefs also please be close. And then following that, we'll take any other questions you may have. If I could just ask you to announce yourself and your organization before you ask the question. Hold on, I'm going to take the press first, and then I'll take some community questions. Yes, ma'am.
With WMAL News, could you please elaborate on what type of synthetic drugs we're talking about and where they're coming from?
Yes, I would. I'll have the chief come up and talk about, I think you heard the council member refer to the issues that we're having because the compounds are changing continuously. But I'm going to ask the chief to talk about the compounds we're most familiar with, and ask Dr. Nesbitt to add anything about the chemical makeup.
You want to do the chemical makeup of the stuff first?
So initially, when the drugs first hit the market, we were primarily talking about synthetic marijuana, which had a relationship to the cannabis plant or cannabinoids. The DEA back in 2013 listed the 5 most popular drugs that were found, or products that were found in those compositions as being Schedule 1, which meant that they had no health benefit and had high abuse potential. So those are not found in the products anymore. What makes this extremely difficult is because now those products are Schedule 1, we know that the composition is being changed very frequently. What we're seeing as a presentation in the hospital is that this isn't presenting similar to what THC, which is the active compound in the marijuana plant, anymore. It's presenting very much like PCP and other hallucinogens. When synthetic marijuana first hit the market, it was more likely to make you euphoric. Now it's making you more likely to be psychotic or hallucinogen. And that's why we're very committed to trying to get this product off the street, analyze it, and see what's actually in it. It could help inform our efforts around putting more things on that list of things that should not be marketed or should not be sold. However, there are other tactics that could be used to get at how this product could be regulated in terms of how it's being sold. Just simply labeling it as not for human consumption will not make you immune to any penalties from MPD or DCRA in this particular instance now. We will still be able to penalize you as it relates to marketing this drug for sale in your stores. So the issue for us is that if you are selling potpourri as a synthetic drug in your store, that will still be a problem here in the District of Columbia.
So most of you, their question of the source, where is this coming from? So it's growing every day. The vast majority of the products that are packaged in labels that we've seized over the last few years are coming from China. We're starting to see that now not be the sole source, that it's coming from multiple different areas, and sometimes we just don't know. We know a lot of it is being networked in through California over to the East Coast. But with the chemical compounds changing, the synthetic drug world now is a whole new market. We've actually, encountered some drugs that, somebody could literally be making in their bathtub at home and then marketing out in the communities for people to use.
Paul Wagner with Channel 5. Chief, can you explain the difference between the CIU unit and your traditional mice unit? operating on the street, and then Chief Ramsey had a former program called Mobile Force, which sounds somewhat similar to what you're doing. Can you explain the difference?
Yeah, it's not at all like Mobile Force. Mobile Force was a uniform unit that was designed to go out and do high visibility, high impact policing. So they really were deployed. Mobile Force was used during the hotspots policing days where they were deployed into hotspot neighborhoods in uniform. So what CIU will do is enhance several of the other units in the police department with their training and technology. So right now, the 7 district vice units, the reason we decided to go away from the 7 district vice units to a centralized drug enforcement strategy is because we realized that things aren't as much neighborhood based as they used to be. We used to have the 7 district vice units to deal with the open air markets in those different districts. But now we're seeing the network for the drugs that are out there. There's certain drugs that are networked through nightlife areas, MDMA, Molly, right? They have their whole own network. So the drug dealing of that drug is very different than dealing of PCP. So you really need to have, if you look at the drugs that give us the biggest threat right now, PCP, synthetic drugs, the other MDMAs and club drugs, those 3 things all are sold, marketed, and distributed very differently. And you have to have units that have an awful lot of training and experience to be able to interdict those drugs through those networks. And so the CIU will help with that. There is a street-level drug enforcement unit that is over at Narcotics and Special Investigations Division, and there is a major narcotics unit over there. So these units will all work together, but the CIU's main focus is disrupting the criminal enterprise right now that's bringing so much violence to our streets. So PCP, as you know, Paul, PCP, and now the synthetic drugs, a lot of violence associated with it. And with the club drugs, overdoses, deaths being associated with that. So that's our main focus, making sure that we are saving lives and preventing violence, and that's where they're going to spend all their time. Yes?
Bruce Johnson, Channel 9. With the announcements you've made this morning, should residents be concerned about the petty crimes that have been associated with the addicts, the burglaries, the break-ins? Who's going to police those things to make sure that they don't have
So we're still going to police those. The district, patrol districts still have uniform officers, and they also have crime suppression teams, which are uniform officers who are specially directed by their district commander. If there is a burglary issue, they will work in the areas and the times where burglaries are occurring and focus on burglaries. Same thing with theft from autos and other crimes. So there's no change in the way we're dealing with those types of crimes. Really, the big change for us is in a variety of plainclothes operations and now having a very singular, precision-like focus on going after those things that are creating the biggest harm in our communities.
Seagraves, Channel 4. Does anybody know the current fine for a vendor who is caught selling synthetic drugs?
$2,000.
It's $2,000.
2 to 10.
It will go from 2 to 10, but the chief thing that I want to call attention to is that the chief will have the ability to shut them down for 96 hours during a period of investigation. If there is a second occurrence of selling the synthetic drug, it would be a 30-day shutdown period in the revocation of the business license.
So that brings me to my follow-up is, does the chief have the power now to shut down a club that has been experiencing overdoses of MDMA, which she puts on her list of top 3 threats?
She does not.
So why not add that to her arsenal?
We're focused now on the sale of the drug. And in the retailers that are selling it, certainly we have a tremendous concern about illegal drugs being used anywhere, and we are watching very closely how we can work with our business owners. Yes.
Muriel Bowser, you mentioned that dozens of overdoses of synthetic marijuana or drugs have taken place in the past month. A lot of those have occurred near homeless shelters or other homeless residents. Especially in downtown. What sort of measures are in place to sort of control those areas and monitor what's going on downtown?
Well, certainly, I think what we're announcing today will give us a heads up. We were kind of reacting in the last several weeks. We when people were showing up at the emergency room or not, or just getting reports. So I think that the surveillance measures that Dr. Nesbitt will be focused on and working with emergency room doctors will let us get to people who need help and identify the trends sooner. Certainly, we have asked our Department of Health and Human Services and our DHS to work with our partners who are working with our homeless population to have the same public education campaign around those issues. Yes. Okay, so the question is how many officers are going from Vice to the CIU? Okay, Chief.
So two things. We did not just take Vice units and then send them over to Narcotics and Special Investigations Division. We disbanded the Vice units. We disbanded the Vice units as a whole, and we announced vacancies for very specific qualifications for people to apply for the new unit. So it is not taking Vice units and putting them over a narcotics branch, so there's no comparison equivalent. The strategy is much more coordinated now so that you have, again, you'll have a street-level drug enforcement unit, a major narcotics unit, your criminal interdiction unit, your gun recovery unit, all working together to combat those things that are resulting in violent crime and death in our community. So they're going to work together. So it's not a one-for-one swap. Overall, the major narcotics branch, in coordination for this effort, close to 100 folks will be dealing with all of these violent crime issues and criminal enterprises, to include the businesses. And to Mark's question about the authorities for the businesses, you know, I take very seriously the closure of any kind of establishment. You know, this is someone's livelihood, and if there's nothing, when I look at nightlife closures, if there's nothing that the business owner or management could have done to prevent it, or they took every action they could, sometimes I don't close them down even when there's significant injuries inside of the club. I have to look at the totality of circumstances, and if the business either didn't do something they should have done, or they failed to do something, then I will take that action. So the same goes for the businesses with this synthetic marijuana. What we've seen with all of our seizures is we'll go in and seize large quantities and warn the business and give them a fine, and then we're back again seizing again. So this is not something the businesses can push under the counter and just pay cash only and get away with it. We're going to continue to come after those businesses and put them out of business.
I want to ask the Chief a question. Since the 90s, the district and the police districts have always had vice units, and they have functioned well, they've had their problems and what have you. But you're making a fairly dramatic change. To what extent have you discussed your proposal with the Citizen Advisory Council or the community group? And if not, why not? And why do you think, what went into your decision to make this dramatic change?
So, you know, every year we take a look at what it is our ongoing challenges are. So what are we working on and what are our challenges now? And what's going to be the biggest threat in the upcoming year? So we usually pull together, and this year was no different this past year, we pulled together a group of our subject matter experts from around the police department. So I brought in vice officers, I brought in detectives, I brought in sergeants, lieutenants from all across the department, all the specialized units and patrol. And we spent several days going through what are our biggest threats, what tools do we need to fight those threats, and how do we organize so that we are having the biggest impact on our city. And what we came up with, and I should say what the members of this police department came up with, was recommendations for how we're going to go after the things that are causing, you know, repeat violence in our communities and the drugs that are the biggest threat. And so this is what we came up with and putting this strategy together. Now, over the course of the past 8 months, you know, I first mentioned that we were working on this back, I think, September or October of last year. This team has been putting this strategy together and finally ready to roll out. So we have been, I started hitting community meetings over the last week.
Community details as regards to how dramatic this was going to be in terms of ending the vice in the police district?
No, I did not, but I am now. We are going to community meetings. I went to a meeting last week.
Hold on, Ms. Brazil. Let the chief finish her.
Right. So, first of all, there's a little bit of inside baseball here. It's very difficult to engage community members in certain things. What we do engage community members on and listening, and I tell you, I read all 7 listservs. I got over 20,000 people putting stuff on my listserv. I am very in tune to what the community members want here. I interact with them every single day, and I know what I hear from my community members. So it's not a matter of us, making these decisions in a vacuum. We make these decisions in conjunction with what we hear from our residents is the biggest problems in their neighborhoods, and I think we've come up with a solution that will help.
Who hasn't gotten a chance? This young lady here, and then I'll go to you, Abby. Yes, ma'am.
Hi, I'm Deirdre Bannon with The Current. I'm wondering if someone can speak to how many retail establishments across the city we're talking about in terms of sales of synthetic drugs, and what that retail value represents in terms of how much is being sold.
Okay.
And where?
You want to get? Okay, so your question is, what do we think the target bad actor retailers is?
How many retail establishments are there? Where are they? And how much does it represent in terms of sale dollar amounts?
Okay, I don't know if we'll be able to get a kind of off the cuff number on how many retail establishments that there are. I'll have the director of DCRA talk to us about in round numbers about our business licenses. And I don't know if we can tell you that we know how many are bad actors. I will tell you this: the vast majority are doing the right thing. And so what we will rely on are reports from the community, from the police department, from our partners about the retailers who are the bad actors, and that's where we'll focus our attention.
I can tell you they're in all 8 wards, the bad actors, although most of them are good actors. And we rely on our partners with MPD whenever they make the arrests and the bust and the seizures, then that's who we go after. So in terms of numbers, we don't have a number of everybody who's doing something wrong, and that's pretty much it.
Yes.
Thanks, Mayor. Since something like internet sales transcends district boundaries, obviously, can you talk a bit about how MPD is working with the DEA or other agencies and also with authorities in Maryland and Virginia on that?
Sure. So, Chief, the question is about the research tactics around internet sales, and that could probably apply to a lot of what you do.
It's actually, the Narcotics and Special Investigations Division is the place where all of my task forces are housed. So they currently have task forces with the FBI, DEA, ATF. So all those task forces now, this is the other benefit of centralizing these operations. All these task forces now all kind of focused on the same threats and working in the same direction. We are very fortunate that our partners here in Washington, at least, our federal partners have been very responsive to supporting us on what we believe is the biggest threats we face. So all those task forces will be working out of the same division.
One more question.
Okay, sir.
Josh Solomon, Washington City Paper. During marijuana legislation, how are you preparing for synthetic marijuana issues that may come around when the legislation is passed?
Which legislation are you referring to?
Any of the legalization marijuana.
Okay, now I separate anytime I talk about synthetic drugs, because you heard Dr. Nesbitt talk about what we're dealing with now. It has virtually no similarity to marijuana. And so anything that we consider around issues of sale and regulation of marijuana, in my view, don't have anything to do with the synthetic drugs. Synthetic drugs in the District of Columbia are illegal, and we're focused on our tactics from the point of sale in ridding the city of it.
Synthetic marijuana, or what's claimed to be synthetic marijuana?
We've seen a spike in overdoses, in people getting sick from synthetic marijuana. Mark, you want to have the last question?
Just disconnected my camera.
All right. Thank you, everybody. Thank you very much.